Okay, so we're quickly trying to move to the next artery, which we are trying to look at its clinical importance, and this is what is known as a medial circumflex femoral artery. So the first thing is we are trying to actually identify it on this image. So you can see that this is the medial circumflex femoral artery, and they can't even talk about this artery without drawing the femur. Do you understand? So it provides key blood supply to the femur. So it's actually a branch of the profunda femoris, which is the deep, also known as the deep femoral artery. So what is its clinical importance? So the femoral head vascularization. So it provides key blood supply to the femoral head and the neck, primarily through the posterior retinacular branches. So if it is disrupted, if it is cut or is blocked, it could actually lead to what? Denial of blood supply to the femoral head, leading to avascular necrosis. Okay, so trauma risk. So it lies in a vulnerable region. So if there's fractures to the femoral head, it could also affect the blood vessel. So injuries or interruption to its blood flow now still further worsen the symptoms of the fracture. So of course, if you want to do any surgeries around the head of the femur, you must have the anatomy of this artery, because you don't want to injure it. So surgical relevance to all those hip surgeries, you have to know the course, because you want to maintain the blood supply to the femoral head even after the surgery. Okay, so for this artery, these are the various clinical importance. These are the various reasons to why we actually study its anatomy.